I'm Dr. Sean Liston. I'm an ophthalmologist. I specialize in cornea and external disease as well as general ophthalmology. Cataracts are normal. Everybody gets cataracts. It's the normal aging of the lens inside of the eye. Something that happens is eventually the cataracts get to a point where we can't correct your vision even with glasses or contact lenses. And then only if the patient is bothered by their vision, whether that's glare at night, difficulty with nighttime driving, or driving into the sun early in the morning or late into the evening, or if they have difficulty in reading in low light, then that's when we talk about considering cataract surgery. I may be biased, but I happen to think that cataract surgery is probably one of the most successful surgeries in modern medicine. It's an outpatient procedure. It is extremely successful with one of the lowest complication rates in surgery. And even when a patient has a complication, usually they're still better off having had the cataract surgery than had they not. We offer at Chico Eye Center a number of lens options. There's the standard monofocal lens, which is covered by most insurances and can serve to still reduce your dependence on glasses in some capacity. But we also offer a couple of other solutions to try to reduce a patient's dependence on glasses, whether that's correcting their astigmatism, where the eye is shaped like an American football rather than a soccer ball, or if we're trying to really reduce a patient's dependence on glasses by correcting their vision for both distance and up close for, I would say, 80 to 90% of their activities. We have a really precise method of correcting a patient's vision that is tailored to them with the light adjustable lens, which allows us to correct for however that patient has healed a few weeks after surgery without any increased risk to the cataract surgery. The surgery is exactly the same, but with this device we can treat the lens without any additional surgery to correct their residual prescription once all of the healing has taken place. And these lenses will last you for the rest of your life. There is no replacement that is needed. So once you've gotten the cataract surgery and you've healed from it, you should stay where you were targeted for the rest of your life. So we also offer laser-assisted cataract surgery for patients who would prefer to have a computer-guided laser perform some of the steps in the cataract surgery. Cataract surgery by itself is extremely safe, but this adds one added layer of safety if the patient desires.